take care of women, which is not correct. Men are just as caring as women are, and men do a pretty good job at gynecology. Women are very smart, probably taking care of for your MBBS preparation, for your PG entrance preparation, and even for your FMGE exam, the MCI exam. We have a very good app, that's a Prep Ladder app. It is giving you all of this knowledge.
So hello, sir. I'm very glad you are here. And lots of students have asked many questions about FMG and medical fraternity and what you have done so far. So let's dive in with you, sir, in the field of OBS and gynae.
Right. Pleasure to have you take an interview from me, Dr. Amir, and happy to help in whichever way.
So, sir, my first question is, recently a movie आई थी Dr. G. I know you must have heard of that movie. And according to that, I want to ask you, what are the challenges of male gynecologists, sir?
Well, this question has been asked to me by not less than 4,000 doctors. My inbox was full when this movie came out. And to his credit, Mr. Khurana has done a very good job in the movie. But, it's not even half as bad as it was portrayed in that movie. It is a very, very stenopic kind of vision that people feel that male gynecologists are not welcome in the fraternity of women who are gynecologists. And it's a very, I think it's unfair to say that people are thinking that way anymore. I'm very sure that men are now welcome in all branches, like women are welcome in all branches which were male dominant, like orthopedics and surgery. So men are doing very well. And from, ever since I was a student of MBBS, I remember learning most of my gynecology from teachers who were men. So it's not that, when I was in JIPMA or, the books we read anywhere in the country, the famous few books are all written by men. So I'm not saying that they're any better than the women. Please don't get me wrong. But then this is not true. What was shown in the movie was, it was for fun's sake and trying to show a man trying to get into a female-dominated kind of a profession. So that's all. Besides all of that, it was good fun. That's all. I mean, not even half of it was truth. Yes, some places there might be, bias towards having only women take care of women, which is not correct. And thinking that way is unfair, and I feel it is not required in present society. Men are just as caring as women are, and men do a pretty good job at gynecology. So what was shown in the movie was good fun. I wouldn't say it was a bad movie. It was a good fun movie. And it was not exactly the truth.
So, sir, are women comfortable when they get treatment of OBS and gynae problem from a male doctor?
I don't know why this question is asked often from men who are gynecologists. Women are just as comfortable as they are with women. Yes, there could be an initial hesitancy, which I would give women the respect, and I would give them their own choice to show to whom they feel they are more comfortable with. But if they know that the gynecologist is good, then they come to show a doctor. They don't come to show a man or a woman. They come to show a doctor. So if you're good in your subject, and if you're good in your behavior towards women, and the way you deal with women, I mean, if, women are very smart, women know the way a man looks at a woman, even forget doctor, a man crossing a woman and the way a man behaves, the way a man behaves in the presence of women know exactly what a man is thinking. So women know everything. So when women come to a gynecologist, and if the gynecologist is well behaved and he's in the right frame of mind of being a doctor and not being a man, if he's in that right frame, then he will never face a problem. And take it from me, I mean, like, this has always been my focus, to give respect to women, because women are patients. So when they come to you, give them the respect they deserve, and they will know, they will reciprocate your feelings. They will reciprocate that how you respect, they will respect you just as much.
Sir, any specific challenges you have faced in your initial stages of career when you started as a male
Yeah,
gynecologist?
there was this time when I was doing my MBBS in JIPMER, and when I got into MD, that time nobody told me. I mean, 50% of the PGs in my department were men, and when I was about to finish, one of my professors just pulled my leg. That which when you're going to Delhi, you'll be probably taking care of animals. You know, you won't be getting women to take care of you humans because it's a very biased kind of a place. I said, sir, coming from you, I'm getting a little worried now. No, let me go back to Delhi and give you a feedback. And in 3 months of me landing in Delhi, and God was kind to me. And I think what I told you before, it worked. And the way I took care of women of where I'm working in St. Stephen's Hospital, it's a great place where they took, where I was working as a registrar, and then I became a consultant. And patients have always come to me as patients and not as women coming to a man. So it's never been a problem. In 3 months of me joining, I was having more patients than the average doctor who was seeing patients in the gynecology OPD. So I've been blessed by the Almighty, and patients have been coming to me. So it's not like that. I mean, like my professor was having a laugh with me on the phone when I called back. I said, sir, I'm seeing humans. I'm seeing women who are humans and not female animals. So yes, it's not like that.
Yes,
It's not beyond a joke, not beyond a joke anymore. Yes.
yes, sir. Sir, I'm very fascinating with the words ops and gynae, but I myself are looking from outside only, and you are actually feeling it from inside. So, from inside, is it a stressful job, or will you please tell us the inside story of ops and gynae, doctor?
Well, it's just as stressful as any other clinical branch, but then let me tell you, it's a happy ending department. You know, obstetrics is a department where you always end up with a happy ending. I mean, you're always giving good news to the patient, and even gynecology is a branch. I mean, where you can do very good corrective surgeries, and so is high risk pregnancy as a super specialty, or fetal medicine, and IVF and endoscopic surgery. So, obstetrics and gynecology, the kind of ramifications it has in super specialization and the kind of work we do, it's a complete branch in itself. I mean, just looking at a pure MD obstetrics and gynecology, he takes care of all the problems of a woman who is pregnant, if be it medical problems or surgical problems, and the obstetric problems. Of course, if there is a, if there's a due perforation in a pregnant woman, or if there's appendicitis, of course, we'll get a surgeon involved. But more or less, all the problems will get taken care of by the gynecologist himself. So it's a branch which is complete in itself. We take care of a woman as a whole. I mean, we don't want to just take care of a woman's pregnancy. So that's the fascinating part of gynecology, that you have a knowledge of medicine, you have a knowledge of surgery, and then you have knowledge of obstetrics. So this is that one branch which gives you a lot of medical exposure. I mean, I take care of all the medical problems. I mean, be it gastroenterology, be it, general medical problems, or be it some small surgical problems. Whatever it is, we take care of the woman. If there is a requirement of specialists, of course, we get them involved. But most of the problems we take care of them ourselves, be it medical or surgical, and of course the obstetrics we take care of. And then this is that branch which makes you feel completely in charge of this pregnant lady. So this is that branch which gives you medical, surgical, and obstetric exposure all together. That's why I feel it's a branch which is different from the other branches, because the exposure is limitless. And your knowledge of medicine and surgery is always going to be used as an obstetrician. So that's what is the fascinating part.
Absolutely, sir. So, sir, students के point of view से जब वो MBBS करते हैं, फिर PG की प्रिपरेशन करते हैं, FMG की प्रिपरेशन करते हैं, तो उनको ओप्स एंड गायनी सब्जेक्ट को कैसे प्रिपेयर करना चाहिए?
तो बहुत सारे साधन है. We have so many ways of reading, but the basic always stays that you must read your Shaw's Gynecology, you must read your Holland Bruce or your Mudaliar Menon. These are the basic textbooks. Llewellyn Jones is a very good book in Obs and Gynae. So when we say of these basic books, these never lose the charm, because this is how we read. But then, yes, now for your MBBS preparation, for your PG entrance preparation, and even for your FMG exam, the MCI exam, we have a very good app. That is a Prep Ladder app. It is giving you all of this knowledge together in one place. If I want to give you if I'm teaching you, every time when I'm taking a class for you, whether it is on a live session or it's a recorded lecture, you know what is coming in my mind? It's not some book pages which are going in my mind. It is all the clinical questions which have come ever in your exams. So every MCQ which has come in a topic, if I'm taking a class on PPH, so whatever MCQs have come on the amount, what is PPH and what is the presentation of PPH and how we diagnose PPH, what are the types of PPH and how we can do the medical management and what is the surgical management, all of that is not going through my mind as pages of some book. It is going through my mind as how I practice this in my life and how these questions have come in your exams. So basically, when we make this app, it's an amalgamation of all the books which I've told you and then my clinical knowledge. So that's why we say, going to PrepLadder and reading the app along with the videos, doing the notes. That's what we always say. Don't just take the notes or don't just do the videos. Along with the videos, if you're doing the notes and then then it's a very good preparation for your MBBS exam. And then if you've done your basics from this, your MBBS exam from this, revising that and, adding the extra points, which we tell you with the, every time there's a new exam and a couple of new questions have come, new topics have come. So we always discuss those questions with you in those online, the YouTube lectures of all the exams which have come. You can always add those points into your PrepLadder notes and you can have a complete revision of your topic just before you're writing any exam. So be it FMGE exam or be it your MBBS exam or the PG entrance exam.
So sir, you have mentioned many things like video lectures, notes, and many more things which are provided by PrepLadder to the students. Would you like to elaborate one by one what are the role and what these things are giving to the students?
So one is that we are giving you comprehensive knowledge, a clinical knowledge of the subject. Every topic is, if you go through my lectures, you'll see every topic which I'm discussing with you is full of clinical examples of my own personal experience with patients over these 26, 27 years of being a gynecologist. So every topic, I'm not just saying, just the topic of APH and the topic of PCOS. I'm talking about even the physiology of menstruation topic or the anatomy which we're discussing, some clinical situation will come into this. So we are taking care of your clinical aspects with the video lectures. Then with the question bank, which is the only clinical question bank in the country, we are recreating those situations once again for you. So when you've gone through our lectures and then you're going through the questions in the question bank, then what students tell me that when we're reading these questions or when we're solving the questions in the exams, they suddenly imagine me sitting in front of them and discussing this clinical situation, which I saw in my exams, and they could recreate that situation and solve that MCQ just because, they've gone through the coaching with us. They've gone through the clinical MCQs, which are there in the PrepLadder notes and the question bank. Once they go through this, then solving this clinical exam situations becomes very easy for them. So that's why I feel that it's that complete clinical outlook to teaching which we have in PrepLadder. I mean, I'm very confident of my app that every time I quote talk about any condition, I'm always full of clinical examples, and that's what is helping. And every time they solve a question in the clinical question bank, it's not that there is just one question on PPH. There'll be many questions on PPH, recreating several clinical situations, so that finally when you get up and you get maybe a different question from what came in the question bank. But if you get even a different question in the exam, you can answer it comfortably because you've gone through the clinical aspects of it with us in many ways. And the best thing about the app is that once you have the video lectures seen, then you have the notes done, and after that you have done the clinical question bank. You are almost complete with your information of obs and gynae. But what happens? Lo behold, we have something called the treasures. I mean, you don't have the time to go through all of this, all the video lectures and all the notes and all the question banks. Go through the treasures for a quick revision just before the exams. So it becomes a complete picture and a complete understanding, because that's simply, don't do the treasures first. I mean, if you're very smart, go ahead for the treasures. But if you're like me, and 90% people are like all of us, that we all get nervous before the exams and we cannot read all of it, what we've read 2 months earlier. So yes, if you have done your basics with us, the video lectures, the notes, and the Q bank, then doing the treasures just before the exams would be a perfect preparation for your exams, be it your MBBS exam or your PG entrance exam.
Yes, sir. Sir, one more question from the student side, sir. The question is whether they should focus more on MBBS professional examination or more on PG entrance exams, sir.
Look, those who prepare only for PG entrance exam, write the PG entrance exam at least 3 times. That is where you people are wrong. If you're asking this question, then why did this come into your head? Because a few, just less than 1% people have been able to do that. That they just focus on the PG entrance exam and they pass it. Now they become very big counselors and they keep teaching you that way. Ki, just read for the PG entrance, forget the MBBS exam. Those who have read for the MBBS exam and prepared for the MBBS exam by reading the classical books, going to the clinics and understanding cases, and preparing for the exams by going through these books or going through our app, those people who have passed the exams by understanding the subject and then prepared for the PG entrance have always passed in the first attempt or maximum the second attempt and got the seats of their choice. So let me tell you, those who worked hard in their final year MBBS and have worked very hard in the internship, yes, I know internship is writing a lot of discharge summaries and a lot of reports you have to get, and X-ray reports and, pathology reports, but it's also a lot of understanding why this path sample was sent, why this biochemistry was sent, asking the postgraduate that why was this sent and why was this not sent, and what is the significance of albumin globulin ratio, and why the enzymes are raised, and why the liver is still functioning properly in spite of raised enzymes, and it's not a liver failure but just a mild liver elevated enzymes. So if you are sitting with a postgraduate and doing all this discussion, and then you are writing a PG entrance exam. So all what you've done in your MBBS, your internship will come into your PG entrance exam. Because we are not going to ask you, tell me the length of the fallopian tube, tell me the length of the urethra. I mean, if this question is coming, then it's okay, fine. It's a bonus one question for you if these kind of questions are coming. But we are going to ask you that when we are going to do the surgery on the ectopic pregnancy in the isthmus or in the ampulla, can we do resection and anastomosis, or we have to do a salpingostomy? Then your understanding of the clinical subject and the number of stories you've heard about the clinical situations from me and the patients you managed in the internship, because you ran for the blood. When you were intern, there was a ruptured ectopic pregnancy, you ran for getting blood and for the reports in an emergency, and the surgeon actually chose to do a total salpingectomy because there was a rupture and he did not do a repair. Why was that done? So once you understand that, you've seen the clinical situation with your own eyes, you have practiced with us so many times. I have shown you my videos of ruptured ectopic pregnancy and of unruptured ectopic pregnancies. So that kind of clinical experience, if you're getting with us, that's why we say that once you have gone through this kind of preparation, basics, internship, our app, then you are good for the PG entrance to finish it in one attempt or max 2 attempts. But second attempt is, as a backup plan. Your first plan should be work very hard in the internship, don't cut corners, and read harder in internship. You will find time. People who manage the time well, they have time for everything in their life. Those who don't manage time well, they have always a complaint, I don't have time, I have so many discharges to read, and then I have to come back to work and I have to catch up on sleep and my food, I don't get time to read. I will take a drop of 1 year and then do my PG entrance exam. If you do not prepare well in the first year, then your second attempt is also going to be bad. So please remember, your first attempt better be your best attempt. If you don't get what you like, then give the second attempt. And second attempt should be the last. I always say, first attempt, get what you like. That is achievement. Second attempt, like what you get. That is happiness.
I was like that only, sir. I cleared my MBBS, PG exam with internship only, and my MCH exam with
Look at you.
With PG only, sir, without any drop.
And you're a neurosurgeon. Wonderful, wonderful.
Yes. And all my teachers said I worked very hard during the internship and during the PG preparation, the PG when I was doing MS in general surgery also. So
yes, that's the importance of doing internship. That's the importance of working internship and not telling. I mean, if your papa is a major professor of the hospital and getting him to mark your attendance of internship and you're sitting in a coaching institute, that's not the best way to get your PG entrance, best marks.
Sir, one more thing. You are teaching from too long time, and you have seen changing the pattern of the examination also, sir. Before some time, the questions were more one-liner type questions, and now questions are changing to the clinical questions. Most of the questions are asked are clinical only. So what are your views on this, sir? The changing pattern of the exam?
Well, I feel it is for the best, and we are making better doctors now. And because of it becoming clinical, you are going to get doctors who are going to be smarter when they become first-year postgraduates. There was a time when I used to get postgraduates who have never gone to their internship, and they've managed to do only their coaching. And when they came as my postgraduates, they could not even put a skin suture properly because they've not worked in internship. So I'm doing a cesarean, and I tell my first EPG, she's 3 months into the subject. Okay, fine, I've done the closure of the uterus. Now, why don't you close the abdomen? And she's like, sir, you want me to close all the layers of the abdomen? I can't put skin sutures so far. So when people are going through the clinical aspects of the exam, I think it is for the best. I think it's a very welcome change. We are making better doctors, and it's good that you're going through that kind of an exam. One-liners are not going to, you cannot have a patient of diabetic ketoacidosis with a seeping wound on his leg, and then you're thinking of what is the first line management of this condition in the casualty. You're not going to think that way, You're going to have an overall knowledge of your medicine and of your surgery put together at that moment. Yes. So you cannot be thinking of just one-liners at that time. I'm very happy that it is getting clinical, and it's giving credence to all the effort which teachers like us, all the clinicians in prep ladder are trying to give you the knowledge of even the biochemistry people and the pathology people, the microbiology people in prep ladder. They are creating clinical situations for you, so that once you get those basics understood clinically, then you come to the subjects like medicine, surgery, gynae. It makes a complete picture for you if you're going through prep ladder.
Yes, sir. So, sir, how to use Question Bank 5.0, which you already mentioned is the only clinical question bank of India?
Well, it is very important that please do the app first. Always I say that please do the app first, see the video lectures and do the notes. And the best time to do this is the question bank is once you've done your basic understanding. You must have done your your Shaw's gynecology and your Holland Bruce or your Mudaliar Menon, your basic understanding you would have done with the books in your MBBS days. Now you cannot read all those books, complete books again. So there's a very easy way of reading all of that, and that is through our app. So do it with the Prep Ladder app, and then get to Question Bank 5.0. So when you're going to the Question Bank 5.0, then you'll realize that whatever you read in your MBBS days and what you read through the video lectures, it's going to become very easy understanding. And in the Q Bank, there are some rare questions which come in the exams. You may say, sir, this question which you're solving in the Q Bank, where is it written in the notes of the app? My notes or anybody's notes for that matter cannot create all the situations which can come in the exam. Yes, otherwise it'll be humongous amount of notes. No notebook can give you all the clinical situations which can come in the exam. So that's why the Q Bank is important, that you do the basics with us in the notes, in the video lectures. Once you do the basics, then get to the Q Bank 5.0. Then you will revise all what you read with the video lectures, and then you'll do the extra bits which are present. There'll be one question which has come out of what, like, there was a Robson's classification of cesarean sections, which we never taught to you as a basic, information till 4 years back. Then when it came as a question, we know that there can be one question there was this question on audit on obstetrics. So all of that is taken care of. These kind of extra questions are taken care of in the Q Bank. So Q Bank is extremely important. Don't just bank on the notes and the lectures. You must do the Q Banco so that you have a complete preparation for your exams. Q Banco will give you that necessary revision and that extra sturdy preparation for your entrance exam.
Sir, one last question from my side. You are a doctor, a practicing doctor, and you are an educator too, and you are managing everything so smoothly. So what's your advice to the student to manage their study and work together?
Well, it's very, very simple. Those who can manage their time well, they always have time for everything in life. So I have time for my work. I have time for my classes, whether they are live classes or recording the video lectures. And I do have time for my family, and God bless my family. They are very understanding that, yes, they know that I'm busy, but I'm able to give them quality time. And as I do go for my vacations with them, and we have this time. So it's very important that you are a hardworking doctor. Don't don't think of making money very fast. If a lot of people start thinking of money as the prime motive to start working as a doctor, then you will not be able to find time for your teaching and your clinical life and your vacations. Then you'll be only working like a machine, because money is the driving factor. If you are a very smart doctor, you'll find time for your clinics, you'll time for your reading and for your publishing papers, and money will follow you. Take it from me. No doctor will starve. Take it from me. Even if it is a person who's done a basic MBBS, he'll never starve. But yes, I don't want you to settle down with that. I want you to become a postgraduate and a super specialist. All of you, whichever subject you take. It could be pathology and then clinical hematology or whatever. But whichever subject you take, become a specialist. And when you start working, a doctor always does well. Money will follow you. You don't chase money, money will chase you. Be patient, and you will have time for your clinical work. You will have time for your reading. You will have time for your paper presentation, attending conferences. And while attending a conference, if you're going to Barcelona, might as well see the whole city. Why just go only for the conference, isn't it? So you'll have time for everything in life, because you are managing your time well and you're hardworking. Hardworking people always have time.
Thank you very much, sir, for your time. You are so nice.
Yeah, it's been a pleasure speaking to you, Dr. Amir, and I hope the students gain from this and become gynecologists and obstetricians, and think about the positive of this subject. Don't relate what happens in the labor rooms and all the noise which is created in gynecology unnecessarily. That is not what obs and gynae is all about. Yes, it's a very busy place and there's a lot of noise, and don't relate obs and gynae just with that. That's one place when people go and they start thinking that, okay, obs and gynae is all about a lot of noise. So don't just judge